How does the coronavirus spread? Starting in the city of Wuhan, China, cases of the so-called new coronavirus disease rapidly spread, reaching all over the globe. What started in the Hubei province, the virus has traveled, and cases have been found in at least 50 countries, including South Korea, Japan, Nigeria, United Kingdom, Italy, France, Iran, the United States, Brazil, and more, with new cases being discovered every day. With more and more countries announcing cases, it is becoming harder to trace how the infection is crossing borders and through whom. The epidemic of the coronavirus disease has the world on edge, with preventative and precautionary measures being advised by health authorities. Countries have closed their borders to countries with high numbers of cases. Public institutions such as schools, universities, and shopping malls have been closed, with some cities in China fully locked down and quarantined. Countries and cities all around the world are bracing themselves for an outbreak. So far, this outbreak hasn't been classed a pandemic, but the WHO has declared it to be a public health emergency of international concern. But what exactly is the coronavirus disease, and how does it spread? What most people are referring to when using the term coronavirus is the disease caused by a virus. The now officially named COVID-19 disease is caused by a virus, unsurprisingly, which is part of a larger group of viruses called coronaviruses, which cause diseases in mammals and birds. In humans, they tend to cause respiratory infections. As a group, coronaviruses are pretty common, and most people get infected with a mild form of the virus, which can cause the common cold and other infections such as pneumonia and bronchitis. However, the form of the coronavirus which has been spreading in the early months of 2020 is a new virus of this family. Scientists aren't 100% sure where exactly the new virus came from, but this virus is similar to one found in bats. So the most likely theory at the moment is that it was spread from bats to other animals, to humans. It is thought that the first spread of the COVID-19 from animals to humans occurred at live animal markets, which are common in the region, and many of those who were first sick had visited these markets. However, the majority of the people who catch the virus and have COVID-19 have not got it from bats or other wild animals, but from other humans. The virus spreads like many similar diseases. When an infected person coughs or sneezes, the virus is transferred in the droplets that are expelled out. These droplets land on surfaces, objects, and other people. When these droplets come into contact with a person's hand, and the person touches their eyes, nose, or mouth with those unwashed hands, that is when the virus can enter the body. Once the virus is inside a person, it can take up to 14 days for symptoms, if any, to show at all. And it is thought that the infected person can spread the virus to others before they show any symptoms and before they feel sick. When infected, people may show symptoms such as fever, headaches, fatigue, coughing, sneezing, and a runny nose. When someone who is sick with COVID-19 coughs or sneezes, they spread tiny droplets which contain the virus further, increasing the possibility of more and more people becoming infected. People who come into close contact with sick individuals have the highest risk of catching the infection, but the virus can spread in shared public spaces as well. The World Health Organization has stated that it is important to stay more than 1 meter or 3 feet away from sick individuals. So it is advised that those who suspect that they have the disease stay at home and limit contact with people. While it may sound like it is too easy for this disease to spread, especially given the number of cases, there are things that everybody can do to prevent further spread of COVID-19. Make sure you cover your mouth with your hands when you sneeze or cough. Use a tissue or, if you have to, your sleeve. Make sure you dispose of those tissues immediately, and if possible, change your clothes. Make sure to wash your hands with soap and water after you've coughed or sneezed, and generally as often as you can. The U.S. Center for Disease Control and Prevention estimates that the majority of people are not washing their hands properly, and recommend to scrub your hands for at least 20 seconds. And make sure you get your fingertips and under your fingernails too. Make sure to avoid touching your eyes, nose, and mouth if your hands are not clean. Various scientific studies have shown that washing your hands is the most effective way to prevent the spread of viral infections and cold, similar to the new coronavirus. Most of these viruses can only survive up to 15 minutes outside the body in droplets, so washing your hands and disposing of tissues as soon as possible, and avoiding coughing or sneezing without covering your mouth is the best way to stop droplets reaching other people, and infecting others with the virus. The virus is easy to spread, there's no doubt about this, and it seems all too easy for people to become sick. However, there's no need to panic, and it is most beneficial to everyone if we remain calm and sensible. It is difficult to determine how deadly the disease is, since it is hard to confirm the number of cases, since many people may not realize they have the new form of the virus if their symptoms are mild. So far, it seems to be less fatal than previous coronavirus epidemics, such as SARS and MERS. While the death toll has surpassed 3,000, the mortality rate is still relatively low, around 2%. The disease is most dangerous for the elderly and those with health conditions, due to weakened immune systems. But we should all take responsibility to do what we can to prevent the spread of the disease, which will hurt the most vulnerable in society. If you are worried about the disease and want more information about symptoms and how to deal with them, you should find out more from your local health authority or trusted sources like the World Health Organization.